Welcome back, brave hearts all over the world. I'm Dr. Darrell Wolfe, and this is called the BHN Powerpack Show. What we're trying to do here is we're trying to demonstrate a whole new level of healing where we bridge nature and true science together, that the human body, if you had perfect circulation, what would you have? You'd have perfect health. If you understood that every cell has an electrical charge in it, and depending on how much energy you have, how much health you have, and how long you live will be dependent on the electricity in the cell, not genetics, not genetics. It's not in our DNA. Aging is not in our DNA. And I actually wrote a chapter about that in the Perfect Day Guide. If you want it, you can get it for free, pdgfree.com. So what we're trying to teach is like Einstein said, energy medicine is the future. And now we have the best energy medicine with a cardio med bed and cell-sonic regeneration, Wolfe non-surgical, and nutraceuticals that have the highest frequency and vibration that I can find on this planet. And then teaching people how to go from what? Victim to hero, patient to practitioner, okay? And fear to faith. Because you need faith. You don't need hope. I hope I get well. Let's just put that one to the side. Now, I have two beautiful women on today. One is Debbie from Stuart, Florida. She runs a clinic down there, a Powerpack clinic. And then we have Magdalena that runs a Powerpack clinic in Toronto. They're going to be coming on in just a short time. Now, understand something. I have a lady who called me, and let me tell you the story, and then I'll bring her on. This is all I know. I don't know any more than this, okay? And that is that she was recommended to actually come in today, but she prayed yesterday that she would have an answer. And a friend of hers said, call Dr. Wolfe. I'm not telling you that I'm her answer. I'm telling you that I have answers for her. So let's make that perfectly clear. I also want to say this, that she's totally panicked right now. And she has anxiety going through the roof. Because she was supposed to go in and they were going to do a biopsy, okay? And they said they were going to do other things. I won't go into it. We're going to call her right now. Because she asked me if I could talk to her. I said, I got to do a show. But I'll tell you what I'll do. I'll call you, and then guess what? You don't have to give your name, where you live, or anything like that. Let's talk to her, and let's see if we can help her out. Let me tell you something right now. We're in this together. Too bad that color matters to us. Too bad that religion matters to us. All the different religions. Ours is the best, right? Our religion is better than someone else's. Too bad that our language is better than everyone else. Too bad that our nationality is better than everyone else, and we don't realize that we all came from the same creator. It is so easy to actually program a human being into a human doing. And if you don't believe me, then how's the transgender thing going? How's the not one day celebrating something? I won't mention it, but we celebrate a month of it now, and we should be celebrating Mother's Day for a month, for God's sakes. Look at how women work. They're so precious. And you know what? And then from transgender, we go to transhumanism. And the reality is, oh my God, there's just no answers out there. And basically, most of the practitioners that people go to are just drug dealers. Because if you're not a drug healer, you're a drug dealer. Did you get that? And you can't be. If you're not a healer, then you're a drug dealer. And the reality is, you're not a healer if you don't teach people how to create a perfect day and for them to become their own practitioner. That's the bottom line. Let's give her a call and see if she answers. Because, she might have wanted me to call, and then maybe she doesn't want me to call. People flip-flop, right? Oh, I really want to do it, and then they don't want to do it. Then I want to do it, and then they don't want to do it. You got to process through your heart, not your head. Hi, love. How are you?
I'm okay.
You're okay.
How about you?
I'm great. And guess what? You're going to be great too. And let's talk. Tell me what's going on.
Okay, I'm in the midst of, a grief. My mom just passed away last month. I'm an only child, and all my childhood traumas, whatever I've gone through, every couple of years comes out. And when I did my mammogram,
Okay, we'll get to the mammogram in a second, but can I say something?
Sure.
Okay, all right. Just understand something. Every couple of years, all my personal tragedies and traumas from my childhood come back up. Now, do you understand that if you understood that the human brain, okay, is not intelligent. The human brain, it only dumps the chemicals and the hormones dependent on the emotion, which is the frequency it's given. Do you understand that?
Yes.
Do you understand that happiness creates happy hormones and chemicals? Do you understand that fear, sadness, depression, anger, jealousy, okay, all of those negative ones, they create negative hormones and chemicals. And the brain is just a chemist and also a computer that runs programs. And from 0 to 7, you had force-fed into you more dysfunctional programs than functional programs. Yes. And if you don't learn, and I can take the time with you, I can't do it right now, but if you don't learn how to process everything through the heart, in your heart, you have 40,000 neurons that they just discovered a few years ago. They thought they were brain neurons, which were brains, we could call them brain cells, but they're brain neurons. That's what we have. We create new neuron pathways in our brain. When we decide to take on something new long enough and strong enough, we can reformulate and rework the way our brain spits things out. But we have to be the computer programmer, and it takes work. Now, they found 40,000 brain-like cells, and then they found out that these brain-like cells give off more light than any other cells in the human body. They also found out that out of all the organs in the body, the heart is the only one that the frequency that the heart gives off, it's unmeasurable. This is all real science. You need to do me a favor, and there's 4 things I need you to do, and start right now, and you take it real serious. And the first thing is you're going to go get a hairband or a hairband. Do you have a hairband at home?
Yes.
Get one that's not too tight, but just as snug as a hug. And I want you to put it on your less dominant wrist. Are you right-handed?
I'm right-handed, yes.
Yep, then put it on your left hand, your left wrist, and make sure nothing else is there. No watch, no bangles, nothing else. Just that hairband. Okay, if you ever take a look at my stuff, you'll see that we have what's called Braveheart love bands, right? And on the Braveheart love band, it says 3, 2, 1, you got this. Braveheart, you got this. 3, 2, 1, you got this. Because when you start to go into a fear state and you count backwards, your subconscious can't count backwards. That keeps you in the conscious moment. So you're going to go 3, 2, 1, I got this. 3, 2, 1, I approve myself. 3, 2, 1, I am loved. 3, 2, 1, I am healed. 3, 2, 1, God, thank you for healing me. Thank you for healing me. Don't beg to be healed. Just thank that. Just thank the universe. Whatever you want in your life, start thanking the universe right now for bringing it to you. And I mean that. This works. I am a powerful manifester, and you're going to find that. The more you follow me, you're going to find out, yeah, I get myself in big trouble because of my mouth. That's obvious. But the reality is this, that I'm a big manifester, and you've only manifested, okay, what you have actually brought on yourself consciously and subconsciously. And most of it is subconscious because you've done no emotional work in your life. You've only been emotional. And if you tell me that you went to a psychologist or a psychiatrist or some whole life coach that took an online course, I think I will just, want to throw up. The reality is this, we have to become the masters of our mind. And the mind is not intelligent. It's only intelligent if you have intelligent thoughts in it. So every time that you start to get emotional, I want you to put your finger on your heart. Or your hand, your finger or your hand. I want you to do this. Me and you are going to talk tomorrow. And if you want that consultation, I will do it tomorrow for you. But for tonight and right now, just do this. Put that finger right on your heart. And believe it, in your heart, you have what's called the God spot. And that's those 40,000 neurons, okay, that shine brighter than any other cells, and they are more electrical than what's in your brain. They can't even figure this out. And they really believe that's our connection to everyone on the planet and that which we call universal consciousness. Now, this is real science. Now, finger or hand on your heart, you're going to slow your breath down right away. You're going to breathe slow and you're going to breathe in. Now, you've got to do this exactly like this. You're going to breathe in 4 seconds. That's in 4 seconds and out 6 seconds. In 4 seconds and out 6 seconds. And you're also going to have a slight smile. And I don't care how painful the thought is or how much fear you have, slight smile, breathe in 4 seconds, out 6 seconds, slight smile, okay? And you're going to do that for 3 minutes. And you know what you're going to do? You're going to put as much gratitude and love for everything that you have been blessed with in your life into your heart. And you do that for 3 minutes right now when you hang up the phone with me. And then I also want you to go into the pdgfree.com guide and look up the Braveheart Oath. And before bed tonight, say that oath 10 times. And just so you know, this has got nothing to do with you following me. This is about you, okay, understanding that you have the power of God inside of you to make the changes that you need to make. And the only reason why you have fear and anxiety right now is because you've been terrorized by those people that they think that they're an authority over you and they want you to do things that you don't want to do. And I have not told you to do anything, have I? And understand, I never will. I will tell you what I would do if I was in your situation, but understand, I will also never ever cause you any harm, because if you need to do something with the medical system, I would have you do it. So here's the deal. So what happened when so what is it they wanted you to come in and do today?
They were supposed to do biopsy on me yesterday.
A biopsy on you yesterday, but you prayed.
On my right breast.
You said that
I prayed and I wanted me to. My intuition was I didn't trust this facility, and I live in Los Angeles. I didn't trust this facility, and I just didn't have good feelings about it. But
okay. Would you say that you are in a place right now that you are in a life-threatening situation that it's do or die?
No.
No, then why are you acting like
it? But I've made it. I've made it like that.
But why are you acting like it? So I want you to know that having all this anxiety, like it's a do or die situation, which you've always done this. And this is not you. This is just a program in you. And you are dumping adrenaline and cortisol, and you are actually, wherever you have inflammation already, you are making the fire grow. It's like throwing gasoline on it, okay? And guess what? Wherever there's inflammation, you have to pull in calcium from your ribs and from your clavicle and from your spine to actually be pulled in to your breast to put the fire out. So now you're going to get calcium deposits in your breast, but because of the inflammation, you are now getting scar tissue in there, and what they're seeing is calcification and scar tissue. Now, I'm not telling you what to do. I'm just trying to tell you there is no such thing as cancer. There's just inflammation. And guess what? They say the cancer spreads. I can prove it doesn't. What spreads is actually anxiety. The more anxiety you have, the more inflammation you have. And even if I had cancer in my breast and then I got it in my spine, do you think the inflammation doesn't spread to the spinal area? Of course it does. It's the next weak link. So the reality is that they also say that cancer's in the family. So there is a project that they called the Genome Project, with $100 billion of American taxpayers' money went into that, and they found out that there is no cancer that is genetic. Did you get that? Even though Angelina Jolie actually cut off both of her breasts because she had the actual DNA in there that says that her mother had it, so she's going to have it, which is a total lie. So I need you to understand something. Don't believe me, but do research. And understand this. We talked yesterday, and you said the only thing that we talked about, I asked you what your weight was and your height, and you said you were 5'3" and you're 195 pounds. That means that you have 70 pounds of inflammation and infection in your body. What would happen if we got rid of 50 pounds of inflammation and infection out of your body? And do you know how fast we could do it? If you actually decided to do the ultimate coffee enema twice a day, if you went on a whole plant-based diet, but better still, Wouldn't it be great? Tomorrow night, 7 o'clock Eastern Standard Time, I'm coming on live and I'm telling people how to do what's called the perfect day whole plant-based keto diet for 2 weeks. And then they're going to do what we call an advanced water fast. If you did that 2 weeks and you did that 6-day advanced water fast, we would come back together, and do you know what you would tell me? Dr. Wolfe, this is a miracle. And I'll say, yeah, isn't it? You are the miracle girl. And you'd say to me, you know what? You'll say to me, I've lost 15 to 20 pounds. And guess what? I am not as stressed. Well, of course, because the more acidic you are, the less oxygen you have. The less oxygen you have, the less minerals you have, because the inflammation eats up the minerals and eats up the oxygen. And that's why we get what they call cancer, because there's not enough oxygen in the cell. Dr. Otto Warburg, he got the Nobel Prize, only person in the world to get the Nobel Prize for discovering the cause of cancer, which is 35% lacking oxygen in cells that are inflamed, okay? So the cell has to mutate, and now it's gonna live off of what? Lactic acid, which you're making a ton of because you're scaring the living shit out of yourself. And because of the sugar that you don't eat, but you do eat. You eat refined carbs and you eat sugar and you have addictive habits. And if you're not gonna get those out of the house, and if you're not gonna get your husband and your children, whoever else lives in the house, to understand that if you keep putting this in your mouth, then guess what? You're gonna need surgery, and it's probably never gonna stop, and you're gonna need lots of drugs to bring the pain down, okay? Are you with me?
Yes, I am.
Okay, so what you could do is you could go into my library right now, docofdetoxlibrary.com, and watch the emotional chemistry of cancer, disease, and healing, which was the largest study that was ever done on cancer to prove that it's emotional. And you're gonna go in there and you're gonna find out the reason why that breast cancer, why you have that breast inflammation they call cancer, and why it's in your right breast, and you're gonna find out that. Now, if you were
They
to...
haven't diagnosed me yet, though, doctor.
Okay, but I'm trying to tell you, guess what? You go ahead. Let me just say this. Go ask your doctor, if I come in and I get radiation, does that lead to more inflammation that could lead to what you call cancer? Why don't you ask them? Why aren't you going for thermography? Thermography shows how bad the inflammation is. Why are you going for an x-ray that creates inflammation, and we already know that it causes and adds to the problem? And then why would you ever let them go in and snip a piece of you in your breast that's so tender and inflamed already? Do you think that if they do that, the inflammation's not going to get higher?
It is.
Oh yeah, and guess what? And as soon as they go in and they snip to get that little piece out that doesn't make a difference, that wouldn't do anything, okay, which it does, okay, it's going to drive it up another 2 degrees. It could be stage 2 inflammation. It'll drive it up to stage 3, wouldn't it? If I take and I cut inside of myself, is there more inflammation or less?
More, of course.
Well, thank you. Okay, and they're going to tell you that it doesn't make a difference. And then I'm going to tell you this, that I know enough women that have, if they find anything too, and you know, most of the time they find a little pea, okay, all right? I was just in LA for 14 days. And the reality is this, I have women that come to me and they'll have up to a size of a plum, and I will do non-surgical and cell sonic regeneration on them. And guess what? That plum, I reduce it down by 30 to 60%. Did you hear what I just said? And that's in 15 to 20 minutes. So right off the bat, I want you to understand that the more scar tissue, the more calcification is because of the more inflammation. And the more inflammation is because, guess what? Are you drinking? If you're 195 pounds, I hope you know that
I don't smoke, I don't drink.
Oh, you don't need to. You don't need to. When you've got 75 pounds of infection and inflammation, let me tell you something. What's worse than smoking? What's worse than smoking? Sitting. What's worse than smoking? A mind that terrorizes you, and you believe that you've got to worry about everything and be on your guard for your children, your husband. And a good mother worries. She's always ready. She's the mother hen. And guess where it's gotten you? And you have an eating addiction, and you eat a lot of carbs and a lot of sugar. And if you tell me no, I'll tell you that we'll go through your foods, and I'll prove it that the sugar is hidden in your foods. And if it's not sugar, it's maltodextrin, and they don't have to say it on the packages that you buy. And you shouldn't have one can or one box coming into your house right now if you want to turn this around.
I do.
So are you going to be a victim? Are you going to blame it on everybody else? Because I can tell you right now that everybody was programmed to actually kill themselves and each other on this planet. You don't notice that? And the reality is, this is a game. It's called a life-threatening, fun-filled adventure. And I swear to God, I will give you a money-back guarantee on anything I do with you. And I mean it. This is not a sales pitch. This is not a sales pitch, because it's got nothing to do with me. The glory, okay, and the power and the healing is inside of you. And for your whole life, you have lacked confidence, okay? You've lacked confidence in yourself, and that's where the anxiety comes. You care about what people think about you. You also need your family's approval, and you know what? You'll give your shirt off your back, but you won't do it for yourself. So I need you to think about that tonight. And I need you to get that hairband, and I need you to gently just snap the hairband. Listen, snap the hairband, not to hurt yourself, because you're going to snap yourself back into the present moment, and you're not going to be fearful about your future or say, I've been so bad to myself. I'm really so bad. Or, oh my God, I'll never make it through this. What am I going to do? What am I going to do? And then guess what? Your husband doesn't know what to do with you. Your family doesn't know what to do with, because they know nothing about health. Nobody knows anything about health. Medical doctors don't know about health, but they know about drugs, they know about surgery, they know about chemo, they know about radiation, and they're really good at it. If you don't calm down, so you need to just breathe. Here we go again. So you're going to snap your band and go 3, 2, 1, I got this. 3, 2, I am loved. 3, 2, 1, I am healed. 3, 2, 1, I got this. 3, 2, 1, I'm going to take massive personal action. And every time you snap that band, that's you kissing yourself. And you know what? That band is going to be on your wrist, and it's going to be snug as a hug. And if you want your life, and if you want more of your life back, and you want to step in your power, and you want to release the skinny person within that body of yours, because there's a slim toned, beautiful woman in there, but guess what? You've used that 75 to 90 pounds to use as your bumper, because you're emotionally getting hurt all the time, and you're doing it to yourself. Your family loves you, but ask them, Mom, please stop fearing so much. Stop having so much anxiety. Please.
Yes, very true.
And I don't even know you, did I? Have I ever seen you?
No.
I talked to you yesterday for what, 5-10 minutes? That was it, didn't I?
Yes.
Okay, so understand something. Don't kid yourself. I am an intuitive. I just don't talk about it. I know a lot more that's going on about you right now. And understand something. It's not even true. You are beautiful. You are strong. And you will get this. And if you want to be terrorized by the world right now, I can't help you. If you want to take these baby steps, if you want to do the Braveheart oath 10 times when you wake up tomorrow morning, and 10 times before you go to bed tonight, look in the mirror and print that Braveheart oath. Go print it. Okay, or write it out. Did you download the pdgfree.com guide yet?
No, not yet, no.
Oh, well, didn't I send you information on it?
No, we haven't discussed any of this.
I apologize. As soon as I get this show done, I'm going to give you, okay, I'm going to give you only 2 videos to go watch. No, 3 videos to go watch, and then I'm going to tell you what I want you to go read in the pdgfree.com guide. But go there now, pdgfree.com, download the guide, and you'll see the Braveheart Oath is at the front of the book. And then guess what? I want you to start reading, and I want you to understand something. We're only getting started. And listen to me, if you can create what they call a disease, and you don't, then guess what? When you become conscious and you learn that loving yourself is the answer, then guess what? Forget cancer. Cancer is just based on corruption, contamination, and conflict, and it's all been programmed into us. And if I can just get you to empty out the cupboards in the fridge and the dysfunctional beliefs in your mind, then guess what? How would you like to have the life that you deserve?
I would love that.
Okay, and understand something. This is not a sales pitch. We do this all the time. Every day I do this. Every day we do this. And guess what? I am nobody special. You could learn how to do this. You could learn how to guide your family. And just know that, okay? And you've always wanted to. So guess what? If you actually learn things that actually work and actually pay off, but first, you don't open your mouth to your family. You observe, no more judging of yourself. You stand in your power and you do 90% of what I ask you. And I promise you, within 6 weeks to 3 months, you're a whole different human being, not a human doing, being programmed or being scared by terrorists out there. Okay? How's that sound?
Very good.
Okay, how do you feel now?
A bit more relieved.
Only a bit, really.
It's a really bad panic and anxiety.
Well, I know.
So the fact that I can breathe
okay,
right
first
now,
of all, there is no panic and anxiety. What there is a program of panic and anxiety that you've been running since you were a little girl. Okay? It also got you the attention that you needed. And that's what people do. They don't even know they get addicted to it. If your subconscious will actually kick it in when you need the attention and the love from your family and the world because you've never ever practiced loving yourself. Yes or no?
Yes.
Thank you. And there's nothing wrong with you. Okay, beautiful?
How do I start this whole diet thing?
Okay.
Keto diet and the water fast and all that stuff that you talked about.
1 second. If you want, you can do the consultation with me. If you don't want to do that, then I'll give you some instruction. But right now, I've got to go and do a show, okay?
I'll do the consultation with you.
Okay, then guess what? I'm going to call you after I get done the show. We'll do the consultation tomorrow, and we're off and running. And then I'll give you my personal phone number, and you can call it as often as you want. But each time you call me, I'm going to hold the line. I'm going to tell you the truth, okay? And understand something. I will never, ever hurt you, but I will tell you the truth. And nobody tells the truth anymore. And the truth isn't that you're bad. The truth is not that you're stupid. The truth is not that you're toxic. The truth is that you've had bad, stupid, toxic beliefs driven into you, and we're going to lovingly change those, okay?
Okay.
All right.
What time can we talk at tomorrow?
Let me just give you a quick call when I'm done the show here today first, okay? And then we'll arrange for the consultation tomorrow, okay? But,
okay, and what was it that you were saying about like getting like the tumors smaller? What do you do when it comes to?
Well, first of all, let's not call it a tumor because that's a dramatization. And understand something. You want to know something? 20 years ago, they used to call when it was not malignant, it was called a fibroid. And then when they believed it was malignant, they called it a tumor. And then they were told 10 years ago to not call it a fibroid, to call them tumors, and that scares the living crap out of people, right?
Yes.
So let's just call it a fibroid because that's scar tissue and calcium. And understand, I get it. The doctors were probably told, hey, listen, call them all tumors, then we're never wrong. But understand something, the people that are actually teaching the doctors, they're evil sons of bitches. There you go. And people don't like me saying that, but they are. The people at the very top, understand something. You need to get this. Chemotherapy, all right? You do know that doctors get paid when somebody does chemotherapy. A doctor gets paid around $3,000 for a chemo patient. Understand something. Chemo is mustard gas. Understand this. Would you put your breast in the microwave? Then why would you put it under an x-ray? Find somebody that does thermography. Do you understand?
Yes.
Because thermography is so accurate. Here, we do thermography at the DoD 5-star healing and training in Ixtapa, Mexico, at our clinic. And guess what? It is the most accurate. You get 7 pages of a total rundown of your whole body, exactly what's going on. And guess what? Why don't you ask your doctor, ask him what cancer is, and he doesn't even know. That is a cell that's starving of oxygen, and it's starving of oxygen because of the inflammation that was created from the infection on an emotional and physical level, and that's it. Do you understand now?
Yes.
Go in and start reading, download the pdgfree.com guide, and just start reading the first few chapters and start reading through the book, and I promise you, you will be a Braveheart warrior woman, okay? all right?
Thank you. Thank you for your time.
And do not talk to any of your family or any of your friends, okay, about this situation, okay? Unless you want to get the answer that they will give you. And that is that everybody's fearful and everybody's scared. Okay, do you understand that?
Yes.
So if you want to be freaked out, then go and talk to them about it. Or you can mind your own business, start going through the PDG guide, and then I'm going to send you some videos to go through. Well, actually, go to docofdetoxlibrary.com. That's not hard to remember. docofdetoxlibrary.com.
Okay.
I will text it when I'm done, and go watch the emotional chemistry of cancer, disease, and healing. Just go do that. Go do it now. And download the PDG guide, and I'll talk to you in 1 hour. Have a beautiful day.
Okay.
Okay.
Thank you.
Bye
Thank
now.
you. God bless.
God bless you. All right, thank you everyone for your patience, and welcome to BHN Powerpack, and I'm Dr. Darrell Wolfe, and we're going to be talking about experiences using cell sonic regeneration. Debbie, would you like to come on first? We're going to be talking about experiences using cell sonic.
Yes, can you hear me?
I can hear you loud and clear.
Hi, everybody. Hi, all Bravehearts. Debbie here in Stuart, Florida, and I have a clinic, Stuart Health and Healing, and you can check out our website at stuarthealthandhealing.com. And if you have any questions, we're here on the Treasure Coast in Stuart, Florida. My phone number is 305-342-9559. And so this week, it's always a great week. It's always wonderful to work with different clients and help them with their issues. And this week we did a 66-year-old male who started having some difficulty when he was urinating. So, yeah, that was interesting. One treatment with the cell sonic rejuvenation and a non-surgical treatment, and it's a miracle. He has no problems peeing. So it's just a wonderful thing. When they go to the doctors, what do they want to do? Give them a pill. They keep them on a prescription, and it really still doesn't work. They still have difficulty urinating. And as time goes on, the guys also have other problems, including the ED, erectile dysfunction. So it's all connected. We cell sonic the rejuvenation with his hip flexors, the pelvic bone, and even the perineum into his prostate. It was wonderful. He had just wonderful results, and he's going to come back. He's going to do 3 treatments, and we're going to get him like he was back when he was, 30 years old. And, this is wonderful. Every week we just see cases like this, and nothing surprises me that we can get rid of the issues that the medical community really can't. They either want to do the surgery, they want to do pills, or just anything that's not going to help. And people struggle, and they have nowhere to go, and they just don't know who to turn to. And so it's important to get the word out there that we're here to help. We're here to help the people that really want to heal their bodies and want to be healed and learn how to do the perfect day and continue doing the perfect day, so that they don't, continue to be in the same mess that they've gotten into. Because we all have, for all of our lives, eaten the wrong way, drank the wrong way, thought the wrong way. And when you know better, you do better. So, that's one of the things we had. And what do you think about that, Doc?
You're absolutely right. But would you do me a favor for the new people that are here? Give them a little bit of background of your background and where you are coming from, and understand something. We work on everyone from horses to dogs to cats to humans to babies to children. There's no limit, okay? There's no limit to being a human being. You know what a human being? Somebody that's intuitive, somebody that has empathy, somebody that uses nature and real science, and it comes together. And guess what? A real human being practitioner actually teaches the patient how to become a practitioner. A real practitioner, okay, New World practitioner, will actually give everything that they have and give their power over to their patients. They won't just treat them, they will train them. And understand, even those people that only want to be treated, you've got to keep on sowing the seed gently, because it's all programming. Even the people that say, oh no, I just want to come in for treatment, I don't want to learn anything. You know, they've actually been programmed to only come in for treatment and learn nothing, and to stay there and understand. And everybody, you need to get this. Every one of you has been programmed that, guess what, you need to do a certain amount of suffering every day or you're not even alive. And if you think I'm kidding, why don't you just start tracking your friends, your family, and even yourself, and then tell me that I don't know what I'm talking about. But please, Debbie, give a little bit of your background and just your broad experience in the last few years of being a New World practitioner, would you?
Retired fire captain from City of Miami Fire Rescue, and I worked over 27 years there. I also am a nurse practitioner. And once I kind of opened up the eyes, and I've always kind of researched and done things for more natural healing. I believe in Western medicine when it's necessary, but I like to do more natural things. It started with a dog I had many years ago when she got arthritis very early in her life at like 7 years old. And I was not going to put my animal on an anti-inflammatory for 7 years. You know, if she lasted to over 14, I did not want to keep her on a medication that was going to affect her kidneys. So always searching. And then a couple years ago, or however long it's been, my partner, Dina, my business partner, she had sent me Dr. Wolfe's videos, and I just loved watching him. And she was like, he's got this, non-surgical technique. And I went ahead and jumped on board. It was time to learn something new. And she told me I had to go do the whole life coach first, because I had to learn the mental first. And I said, yeah, okay, I'm open. Why not? That was I really had no idea what I was stepping into. And I knew in the first 2 hours of the first day of that class that this was the right place I was to be. And you opened up my eyes, just with all the being so logical with everything. It's been a wonderful journey since then. I've done 6 classes with you. So now I'm a master trainer, and I just continue to learn. It's wonderful. Every day learning. And when you stop learning, you stop living. So I like to continue to learn. I like to continue to give back and try and help people. And I've just found that the medical community, the more you sit down and you talk with people and you realize, just like the lady that you were speaking to on the phone, they just put the fear in them. And that they have no understanding of how the body really works. And today I had a client, and she has multiple sclerosis, which she was diagnosed about 30 years ago. She's in her early 60s. So she was diagnosed from, she had a little bout of double vision, and she was diagnosed with lesions in her brain, which was actually scar tissue. So for the last 30 years, this woman has been told that she had multiple sclerosis, which she had no other symptoms other than that first thing that occurred until about 6-7 years ago, when she started having some difficulty walking. So throughout her whole life, she never took any medication, and she still doesn't. She now is using a cane because her walking has decreased. She's, again, in her early 60s. She looks wonderful. She looks so young. It just doesn't go. But she was told. So for 30 years, she believed that she had multiple sclerosis. And really what she had was some scar tissue. And the scar tissue in her brain has not changed. They've run tests, and that has not changed at all. Right now, let's see, her right leg has shortened. So her right leg is shorter than the left. And we know that she's got a lot of calcium, all in her lower back and her, her pelvic area.
Debbie, if you know as well as I do that if you go in there and actually use your Cellsonic and then you actually do the non-surgical, her legs are going to be the same length because one leg's not shorter than the other. It's actually she's frozen in her SI joint and in the sacrum area. And guess what? You know the chiropractor, when he goes crack, all right, it pops back out. So what if we got rid of the calcification, scar tissue formation? Okay, it's not going to pop back out. It might take her 3 to 5 treatments with Debbie, and it's over. It doesn't come back. This is years of calcification and scar tissue formation. And understand something. As far as the MS goes, hey, listen. If you believe it long enough and strong enough, you'll achieve it. And it doesn't matter whether it's something great or it's something devastating. The universe is going to answer you. You came down here to create, and you better watch your mouth, and you better go in and remaster the programs that are in your subconscious. It's only a computer in here. I already told you, the brain is not intelligent. I'm not saying it's stupid.
And that's what I told her. I said, so for 30 years you've been, or 27 years, or 23 years, you have been believing that you have MS because this is what they told you. And all of a sudden you start having some issues with, your walking. So now you really believe that you have MS when actually you just have calcification. The first time that she did come to me, she was dealing with sciatica pain. So we did a low back treatment on her, but we concentrated with the sciatica because that's what she was dealing with the most. She had 95% relief with one treatment. So that was wonderful. She had gone to the neurosurgeon who wanted to cut her, and that's how they wanted to help her sciatica. So again, it's just, we know that we got to get into the low back and we got to get into the hips and the pelvic and the front. Everything is frozen in her whole lower, part. And we're going to free her up, and we probably need to do 5 treatments. I would say at least 5 treatments on the SI joints and the lower back for sure. But, I already have her changing her mindset. I said, you need to envision yourself running down the street without your cane, and you will be running. And she really is ready. She's definitely one that she doesn't want this. I just think that she didn't know any better. And now that we've opened up her eyes a little bit, Dina and I think she's ready for the change. And it's so wonderful when you run into people like this that, she's so young and vibrant. And she said, well, what would I have gotten? I said, well, you would have gone from the cane to the wheelchair to the nursing home. And that's where you would be existing. And that would have been your life. And she says, no, I'm not having that life. And I said, perfect. Keep that thought, keep that visualization that you will be running down that road. It's going to be a wonderful thing. And we'll keep progress on her too, Doc, because she's amazing. She just, we do the work, and she's having great results so far. Yeah.
Let's keep me abreast of it. I'd like to know how it goes. And guess what? We're not going to win with everyone. And it's not that we're going to lose with everyone. Like Debbie just said, massive personal action, and you got to want it. You know what? You can't just sit there and just imagine it. You want to imagine it, but where's the massive personal action? Where is the getting rid of the malnutrition? Where's getting rid of the dehydration? Where's getting rid of the inflammation, calcification, scar tissue formation? Do that, and now we're going to be right back to where we need to be, which is, guess what? Remove the physical and emotional blocks from your life and learn how to fly. First, love yourself. Debbie?
Yeah, so it's just cases like these that really excite me, and it's wonderful to be involved in doing this work and teaching people how to heal themselves. And the Cellsonic rejuvenation is just wonderful, along with the Wolfe non-surgical, the two together. I just can't even explain what it is that bringing the two of these things together does for somebody. It's amazing. It's just I don't think I've ever seen anything like it. And I've been in the medical field for my whole life. You just have to either want it and buy into it, or if you want to take the other way out and go get cut or whatever it is that you want, that's a choice that everybody has. I personally wouldn't want anybody touching me or doing surgery on me when I know that all I have to do is a few treatments here and there to get rid of the pain and discomfort, that, has occurred because of the calcification within my body or the scar tissue or the crystallization. So I'm all in for Cellsonic and Wolfe non-surgical doc.
Yep. And can you tell everybody what we're doing in April?
This April, I think it's in May. So
it's in May? Okay, April, May. April.
Yeah, April, May. I think it's in May. In May, we're hosting Doc here in Stuart, Florida again. It's going to be exciting. So he's going to be doing a class. I know he's got one coming up in Ixtapa shortly, and then in the beginning of the year he'll be in Canada, and then here in Stuart, Florida in May. So you can check out bhnuniversity.com to get more information. So it's going to be wonderful. Again, this will be the third time we're hosting. We have had wonderful classes here. The last class, I knew it was going to be amazing, and it was even more than I could even imagine. The wonderful time that everybody had. People got so much out of that whole life coach and the Wolfe non-surgical. It's powerful classes along with the pelvic restoration for all the ladies. All three classes have been wonderful. And if you really want to take your life back and really learn how to become your own healer and how to heal your family and your friends, you need to start looking into it, guys. It's just wonderful times. And, you just can't ask for more. Like I said, I've been in the medical field for over 30 years, and I have never done or seen anything the way we're doing it right now, helping and actually healing. And, people with plantar fasciitis, one treatment. People with sciatica, one treatment. You get rid of 90% of someone's pain in the first treatment. And what does the medical system do? They send you home with some anti-inflammatories or some pain medication and tell you to deal with it for 6 months. And that's what happened when I had sciatica many years ago, where I lived with sciatica pain for 6 months, which was not fun. But, I didn't know about it back then, but now I know about it, and now I know better, and I do better. Back then, eating high inflammatory foods, thinking I was on a good diet, and you kind of straightened me out in the first class. It was wonderful. I thought I was healthy until you sat me down and said this, this, and that. And believe me, I didn't take any offense to what you said. I totally listened. And I ended up, when I went through menopause, putting on a little bit of weight. I was never real heavy, but just a little bit that I could not lose. And as soon as I did what you told me during the consultation to do, I can't even, my shorts constantly fall off of me because I keep down, I'm like down at 130 pounds. It's like so wonderful to get your life back, to get your body back, to have it detox, to make it work. And when you're putting in the right foods and the right nutraceuticals, and you're detoxing the liver and you're cleaning up, the large intestine, it's just we have been brainwashed like no tomorrow about detoxing our bodies. And as soon as you learn to clean it up, there is no fear for anything that they call dis-ease. It's all inflammation in the body, and it's easily gotten rid of when you do what needs to be done. You do not put diesel in a gasoline car. You do not put gasoline in a diesel truck. And that's what you have to look at, that your body is that car or the truck, and you need to be putting in the foods that is meant to be there that can be digested. And once you do that, it works right. The inflammation goes down, and, that's all there is to it. It's, I hear all the time, I can't give this up, I can't give that up. And I'm like, well, that's your choice. I choose not to live that life of pain when I turned 50 and had arthritis in my hands. You know, I was working in the yard and I wake up and my hands were real stiff. I was talking to a friend of mine and I said, the difference between you and me is that when I developed the pain, I researched what was causing it. And just by tweaking a little bit of my diet, and the first thing I ended up doing was getting rid of the gluten in my diet. As soon as I did that, the pain went away, you know, and the stiffness in my hands went away, and then continued to research and find out that I needed to eliminate a lot more than the gluten. But I said the difference is I did the research, I made the changes, and you chose to go to a doctor and let him put you on a prescription medication. And that's the difference. So it's what you want to do and the choices that you make.
Absolutely. Thank you, Debbie. Can you let everybody know how to get in touch with you? And just
Yes.
know, Debbie lives in Stuart, Florida, everyone. Okay? And it's worth the drive. It's worth the drive. Okay?
So StewartHealthandHealing.com is the website. And you can reach me at 305-342-9559. And we treat, we have the Celsonic, we have the Bioptron, we have the vitamin D light. We do humans, we do animals, we do children, anything that, you know, even when you have a question, we take all the phone calls. And yeah, it's wonderful. It's wonderful. I have a lot of people. I get people that call me. I have one lady that, you know, I've done a couple of treatments on. She just calls to say hi and, you know, tells me what's going on in her life. And so it's a wonderful thing when you get into a tribe of people that have the same thoughts as you and, you know, are striving to make changes into their life and become the healthiest that they've ever been. So.
Thank you so much, Debbie.
Thank you.
Magdalena, are you hanging in there with us?
Yes, I am here. Hi there,
Hi, love.
how are you?
Very good. Everybody, Magdalena is from Toronto, Canada, and she is a master practitioner. And I've done a couple of lectures there, and I will be doing a tour there in November. I'm coming to Toronto, right, Magdalena?
Yes,
Yeah.
we are all waiting for you here.
Well, thank you. Just keep the kettle warm, okay? Anyway, so Magdalena, what would you like to say to everybody, love?
Yes, my name is Magdalena Arcos. I'm in Toronto, and I do Wolfe non-surgical, and I have the sonic rejuvenation of cells. And it's amazing. I was working on a gentleman with lower back pain. So I did the sonic treatment. And after that, I did a Wolfe non-surgical. And the pain was gone. And it was great. And it was a couple. So I showed the wife how to do so they can help each other. We only, we treat and also we like to train.
Absolutely. And just go ahead, love.
I also want to mention I had another gentleman. He had pain in the heel because of the shoes. So I did the Sonic, and what I did after, I applied the DMSO gel with the pain away oil, and I was happy that the gentleman mentioned, oh, I feel that he feel the relief with the DMSO gel and the pain away. Right away, he felt the relief on the heel. It's amazing how our nutraceuticals are high frequency. It's amazing how they can help you to heal.
If everybody understands that, you know, inflammation is a certain frequency that is created in the body. The Celsonic will actually go in and brings a frequency in that'll shut it down. If you go to bhnpowerpack.com, you'll see all the information there, and you'll see that I say, guess what? shuts down inflammation and pain in seconds. Nothing else does that. Understand, you take 25,000 volts and you put it into a love harmonic. Understand, you can take supplements, you can change your diet, you can go to massage therapy, acupuncture, chiropractic, but nothing is going to bring the thunder down like putting the frequency in of unconditional healing into those cells to actually decalcify the mitochondria. So now they'll spin 2,500 times per second to make the ATP. And that you'll actually bring in the vibration that says, no, you're healed. You're already healed. And remember something, that vibration can be done from here as well. Just like this. Remember what I said? Say something long enough and strong enough and it'll come through. So you better watch it, what's coming out of your mouth. And I'll tell you something, Magdalena is one of our most powerful therapists that's ever come out of our training, okay, from Braveheart Nation University. So, Magdalena, where can people get and how can they get in touch with you? And do you have anything else you'd like to add, love?
Yes, I also tell the people that it's very important that you believe. You have to believe in the way you talk to yourself. Because if you say I'm healing, of course, but you say I'm not, you say the opposite for sure. Your body, your 50 trillion cells, listen to your body. And you have faith, you believe that you are healed. And that's why it's very important, most important, mirror work every day, mirror work. And this, I learned from also how my father, he reached 96 years old, but he was 80 years old. He came to me, he goes, oh, daughter, I love myself so much. So much, so much. And he did. When I think about it, he was loving himself so much. He was eating healthy. He was always loving himself. He loved everybody. He never fight. He was a man of peace. So a lot of people love him so much. He was well known in the community in Mexico. And he reached 96 years old. You will ask him, how you feeling? At the end, he was very ill, but in pain, and he will tell you, I am wonderful. Estoy excelente. He will say, excellent. I'm excellent. So it's amazing how the way we talk to ourselves, we create everything. What do we want? Do we want a beautiful life? We are fortunate to be in this beautiful life. And we are courageous people just to be alive here. Let's enjoy every day. Love ourselves, let's love everyone.
That's beautiful, Magdalena. I really appreciate you standing up and talking like this. You know, practice it. Why don't you practice unconditional love for yourself and then practice it for others? Because that's the most important. That's the most important thing that we teach, isn't it, Magdalena?
Yes, it's very powerful. This is what I learned. That's how I got into this, because I didn't know I didn't love myself 10 years ago when I did the implants. Now they are gone, but I didn't know because I didn't love myself that time. So I learned that you mentioned about this group, breast implant illness. So I saw I signed in this group. It's almost 200,000 women there. And here I am. I heal myself, and I want to help that everybody heals. We can all heal ourselves. And we have all these amazing tools that we can use. And it's amazing. All these high frequency products that we have is amazing how we can heal ourselves.
Thank you, sweetheart. Simple. Thank you. So, can you tell everybody how to get in touch with you?
My name is 416. My phone number is 416-669-9351. And my website, torontohealthandhealing.com.
Beautiful. Thank you, Magdalena, and thank you, Debbie, for coming on the show today. And just know this, everybody, We'll be back here next Tuesday, same place, same channel, Braveheart Nation Studios. Okay? So tell others that guess what? Unconditional love is coming your way. And we're going to be doing it every day. 3, 2, 1. We got this, and we love you.